Okay, so I'll be quick. This next talk is just about the trials that we're doing, and this is a fairly exciting sphere for the registry. So thank you for the honour of being able to present it. So to take a backward step, research. So fundamentally, all of us are somehow involved in research by default, because the data that you have in your hospital record can get used without your knowledge, because there's no risk of using that data to ask questions and create research. You may also get invited specifically to participate in research for which you consent for, and unfortunately we're very bad at providing that information. I don't know if anyone's received an information statement and consent form, but usually it's a booklet. Has anyone received one before? Yeah, in the mail. It's usually a booklet that's about 30 pages long that you're never going to read. We've spent years putting it into plain language so that you can understand it, but there's just such a volume of data to get to you, of information, that it's very difficult to actually absorb it all. So I'll try and keep this as simple and straightforward as possible. But the whole point of the research that we do in the registry is to improve the lives of people living with a Fontan. That's the fundamental aim of doing the research. And we do that by creating new knowledge or using existing new knowledge in new and innovative and creative ways. There are some questions that don't require research to answer, but there are many ways to answer research questions. You can do it through basic science. You can do it, as we have been doing in the registry at the beginning, with large amounts of data and analysis, or you can do it with drug trials or device trials. Eve mentioned that we make decisions clinically based on our gut feeling, our observation of 2 or 3 patients, but there is a clear hierarchy of levels of evidence that are used to inform clinical decisions. And they start off with our clinical experience. They then go to observational studies, which have been the bulk of the published work of the registry so far. And then the higher levels of evidence, and the levels of evidence that are attracting the most grant funding from the peak funding bodies in Australia, are randomised control trials and big analyses of multiple trials. And these are considered the pinnacle of the pyramid of data. So what is a clinical trial? Well, the WHO defines a clinical trial as a research study that is prospective, so you enrol someone and then follow them in a forward fashion rather than looking back at old data. It involves human participants, and that's where the clinical part of it comes into. It looks at an intervention that's related to health, and it then looks at the effects of that intervention on health outcomes. And normally we define a clinical question for a trial using this format called PICO. So that looks at the population, the intervention, what we're comparing to, what the outcome is, and how long that time frame will apply. So for instance, in a Fontan trial, in how many patients with a Fontan does treatment with what, compared with what, improve what, over how long? There's a term called power that we use to look at how effective a project might be at answering a question. And we use statistical methods to figure out how many people we need on each side of the trial to get the answer that we're looking for. This also applies to funding. Trials need to be funded. There's also a term that you may have heard of called blinding, and that basically prevents bias from both the people who are participating in the trial and the people who are running the trial. If we know that someone's on the sugar pill and we know that someone's on the real treatment, we may perceive the outcome that we're looking at differently. So a key part of a trial is to blind both the participants and the investigators. There are some trials that can't be blinded, and one of the trials that we're running at the moment is one such trial. The comparator is usually a placebo. Sometimes it may be standard treatment versus a new treatment. Sorry if I offended anyone who believes in homeopathy. You're welcome to leave if you're offended. So why do we do trials? Well, as I said, we're trying to improve the lives of patients living with a Fontan. We might want to test a new treatment, we might want to test a new diagnostic or a screening test, or we might want to test some intervention like exercise that might prevent disease. And those are the three broad types of trials. I won't spend too much time on this, but you may have heard of phase 1, phase 2 and phase 3 trials. I'm getting some nodding heads, so I will go through it. Basically, the phases refer to how significant the results will be on changing clinical practice. So the phase 0 sometimes doesn't need to occur because we already have a drug that we know has a certain effect. But phase 0 is to look at what the effect is on a human body. Phase 1 is a safety trial. It usually runs for a few weeks and it may only have tens of participants. And it's just to make sure that when you deliver this drug to people, it doesn't cause serious adverse events or complications. Phase 2 trials and phase 3 trials are larger and longer, and they look at how effective the treatment is at delivering the outcome and how safe it is in a large number of people. And phase 2 and 3 trials really are the bulk of the trials that we in the Fontan Registry are able to now perform. And then phase 4 is where a trial has been completed and everyone that was enrolled in the trial automatically gets followed up over a longer period of time to look at the long-term safety profile and the risk of very rare adverse events happening as a result of the intervention. So we have 3 trials currently running, and I'll quickly also talk about some that are in the pipeline at the very end. The Rubato trial is a drug trial, a phase 3 drug trial sponsored by Actelion, who are a subsidiary of Johnson & Johnson. They've been bought by Johnson & Johnson. So it's an industry-sponsored, industry-funded trial. It is examining in 134 participants with a Fontan procedure who are over 12 years of age in 11 countries, whether a drug called macitentan, which is a once-daily tablet and has the trade name of Rubato, and it's a medication that relaxes blood vessels in the lungs, and Eve mentioned earlier the name pulmonary vasodilators, so this is a drug in that class. Compared to placebo, will improve exercise capacity, as well as activity levels, quality of life, and clinical events over 1 year. And the trial is expected to take 2 to 3 years to complete. Julian did a wonderful in-depth overview of CPET testing, and the main outcome and the main measure in the study is CPET VO2 max. And the study is being performed at multiple sites, including in Adelaide. So I hope that we will have many participants from today. But it's also across Australia, New Zealand and worldwide. It requires 7 visits over 12 months. And each visit includes a combination, not all of these things, but exercise test, blood test, questionnaires, and over the total time period there are 3 echocardiograms as well. So it's a lot of time involvement both for the research team and especially for the participants. Who can't do it? Anyone who can't do an exercise test, anyone who's pregnant or not on reliable contraception, anyone who has the classical atriopulmonary Fontan. The trial is deliberately targeting participants who are not completely well, who have some symptoms, but who don't have symptoms that are so bad that they're on multiple heart failure medications or waiting for a heart transplant. And it excludes those with SATs who are under 88 because of safety concerns. Just because. Okay. Any questions about Rubato trial? Yes?
I just read the information from you last week.
Mm-hmm.
I want to know how it got through ethics.
What's your concern?
The 1 in 10 children exposed to that, and we're talking about children, will develop really severe complications. That's a really, really big number.
So 1 in 10 have flu-like symptoms.
Yeah, but
So
there are more than that is.
we have made we have vaccinated the macitentan trial in pulmonary hypertension. I talked to Rob Whitehall, who was part of the trial, and that's the drug that we use for pulmonary hypertension. And so we use it because it's actually better tolerated than the bosentan for gastrointestinal effect. And the serious symptoms 1 in 100. So it's a drug that is, so there's 30,000 people, including children, that are currently treated for pulmonary hypertension with macitentan in the world. So it's not a new drug that has been made. It's something that has been that is in current practice. But you should feel free not to participate, of course.
Yeah. So, yeah, but it was more than flu-like symptoms, wasn't it? There are about 5 or 6 on that list of common 1 in 10 complications. And this is the first time I believe it's been used in this setting. Is that right?
So the study is used because they're quite sure that it's going to be working. So the Fontan, which as I said is a very similar drug, but has to be taken certain times a day, and has more gastrointestinal effect, has been proven to be effective in increasing the VO2 max, so the maximum exercise capacity, in about 16 weeks of treatment. So that's the first trial. So it's not the same drug, but it's a very similar drug. And so for them it's a bit of an easy win because if it's effective for 16 weeks, they know it's going to be effective for 52 weeks. So the question is, it may be more effective, but it's the same class, and almost exactly the same drug. It's not really less effective. These are, and as I said, I've been involved in the design of the study and so on. They will not risk to put a drug on trial if they're not sure about the safety. You can doubt that as a person, you should not be invited to it. They would lose way too much money if they go into something that is going to be disaster. And so in a trial, you have a different time point. You have a committee that is separated from the people doing the trial that look at the results. So if you have an unexpected rate of adverse event that comes up, then you stop the trial. And it's not one ethics committee, so it's a worldwide organization. So it's 11 countries, so there's 11 ethics committees which have looked at it.
It freaked me out, that list.
Yeah, adverse event and complications lists are alarming sometimes, and the ranges of the rates that they occur are quite vague often. So it's not surprising.
What did you say? Can you
I
more details?
meant to bring it so that I could actually address the specific ones. Like flu-like was the last. I think it mentioned liver complications.
So liver complication is 1 in 100, and that's the reason why you have.
Because there were 2 lists already.
Yeah. And so that's why you have blood test done on regular intervals. And so as soon as you have changed the blood test, I'm a cardiac surgeon, okay? I'm not a cardiologist, and I've been involved in trial because I'm interested. I think it's important for me to learn about trials. I'm not familiar with trials. It's not something I do very often. And I ask around, and the feedback I have is quite reassuring. But that's from the people who are using the drug. Rachel, do you want to? Yeah.
So I do pulmonary hypertension, and we use this drug more than any other drug in pulmonary hypertension. The chance of dangerous side effects is very, very low with this drug. So when we say it says flu-like symptoms, we don't mean like the flu that we read about in the newspaper. It's feeling a bit off, like you might be getting a virus, and it goes ways into stop the drug. So I'm not sure what the wording is. Clearly from your perspective, it sounds quite
Flu-like symptoms, that wouldn't have alarmed me.
Yes.
I have it here. Yeah, it's on my laptop. The whole protocol.
So maybe we should go together afterwards, but in clinical practice, dangerous complications are very, very, very low with this.
In adults.
In adults, there's also data in children. There is
The next trial, and unfortunately the next two trials are not recruiting participants for performance in South Australia. If you live in South Australia and would like to participate in these particular trials, we can talk about the possibility of that, but they require multiple visits. And the possibility of setting up a study site here may require a bit of discussion for these next two trials. So Rachel is the mastermind of the Cessation Trial, and it's looking at recruiting 50 people with a Fontan who are currently on an ACE inhibitor in Sydney, Brisbane, Melbourne and New Zealand. So ACE inhibitors are very frequently used in those with a Fontan. The evidence for their use is pretty scant. There was one trial that looked at exercise capacity with an ACE inhibitor, but they are very frequently used because they're thought to protect the heart muscle from getting fatigued and deteriorating over time. So this trial will compare stopping the ACE inhibitor with continuing the ACE inhibitor, and it will look at the change in exercise capacity, again using the CPET test, but also the amount of cost that's involved, the quality of life and the change in heart function with stopping the ACE inhibitor. And it'll be over 1 year of stopping and is expected to take 2 to 3 years to complete. The trial requires 4 visits over a 12-month period, and it includes exercise tests, blood and urine tests at each visit, questionnaires, and I think 3 echoes as well. Now, the recruitment for the study was involving very heavily the treating cardiologists because we need to identify those who may be candidates to stop an ACE inhibitor where there isn't thought to be a significant risk of doing so. And some of the risks include those who already have low heart function, leaky valves, high blood pressure. But there were a number of participants who could potentially have been eligible whose cardiologists were not necessarily 100% on board with the idea. And so if you feel like you're on an ACE inhibitor, don't know why, don't want to stay on one, may want to discuss the possibility of being in this trial, please speak to your cardiologist. And if you're willing to also travel to participate in the trial. It's a big ask. Now, the final trial, as has been already explained a couple of times today, the increased pressure on the venous side of the Fontan causes back pressure on the organs in the abdomen, causing potential scarring in the liver and the kidneys. And we can measure the stress on the kidneys just with a simple urine test, looking at the amount of protein that's in the urine that you pee out. So when we did some initial study in a cross-sectional study looking at the amount of kidney and liver damage in people living with a Fontan, we actually found that a substantial proportion, a third to a half, had some evidence of early kidney damage. And we looked at the literature and found that ACE inhibitors, which we're stopping in the other trial, may actually be beneficial at reducing the amount of protein that's lost in the urine, which may have a protective effect on long-term kidney function in people with a Fontan. So we designed and got funding from the Heart Foundation for this study to recruit 80 people with a Fontan who are over 5 years of age and not already on an ACE inhibitor in Sydney, Melbourne and Auckland, to give them a once-daily tablet of perindopril, which is a very widely used, very safe ACE inhibitor, which we know in other diseases like diabetes reduces the amount of loss of protein in the urine and also has a side byproduct of reducing blood pressure, compared with placebo on the amount of protein that's lost in the urine over 8 months of treatment. And we expect the trial, when it begins next year, to take approximately 1 to 2 years. It requires 4 visits over 8 months. Again, it includes urine tests, blood tests, and a special scan of the kidneys called a DTPA scan. And if any of you participated in the liver and renal study, which was done in Sydney, Melbourne, and New Zealand, The DTPA scan is about a 3-hour test where the kidney function is measured using a very low dose of radiation that's injected through a vein. Anyone who's pregnant can't take an ACE inhibitor. If you have really bad kidney function already, if you have bad heart function, if your blood pressure is high and it's not being controlled already on other medications, or you're on any medications that interact with perindopril or already on a clinical trial, you can't be part of this one either. So those are the 3 trials that are currently undergoing in the registry. I think if there are any questions, we'll have them at lunchtime, because we're very severely over time. I do want to say on behalf of Eve that we've currently applied for funding for 2 exercise intervention studies, and we'll find out in November and December what the results of those funding applications have been. So those will be very exciting. Anything you'd like to add?